We're very excited to have our next session on using policy to increase public understanding and enhance state and community readiness. The two presenters that you'll have today for this panel are John Auerbach, who's the Associate Director for Policy and also the Acting Director of the Office for State, Tribal, Local, and Territorial Support at CDC. And we also have Robert Eady, who's the Health Officer and Administrator for Monroe County Health Department in Monroe County, Florida. So with that, John is going to start us off, and we will have a nice session here, and there will be time for Q&A at the end of the session.
Great. Good afternoon, everyone. Thank you, Sarah. So, as you heard, this presentation is going to focus on the ways to utilize policy, including existing laws as well as new laws, to implement your Zika action plans. And while I am currently at CDC, I also approach this issue through the lens of having been both a local health officer and a state health officer for about 20 years, and having gone through a number of different emergency responses, including arboviruses ones like West Nile virus and H1N1. In starting out, let me just clarify that this presentation will deal with some legal issues, we'll talk about some policy issues, but it's not intended as a substitute for professional legal advice, obviously. Your own general counsel or your experts are the best ones to assist you in customizing your plan to the particular conditions in your own community. I'm going to be addressing three main topics that are related to policy, and I'll also list a few other ones at the end of the presentation that should be on your radar screen. The three are the ones that are listed here. They're the community readiness and engagement. They're the day-to-day non-emergency mosquito control actions and authority that currently exists. And then there's the question of activating emergency powers. I'm going to start with community readiness and engagement. And you may wonder, how does this relate to policy? And I'll talk about that in just a minute. Certainly it's true that executive leaders at all levels of government play a very important role in communicating about public health threats, in the actions that governments will be taking to respond to those threats, and also what the steps that can be taken by members of the public to protect themselves. And you heard a little while ago from the communication experts about the importance of engaging early and throughout the emergency response, and how key it is to provide positive, ongoing two-way communication with communities in order to have them feel fully engaged. I'm going to relate that to the issue of policy development by giving you two examples where community readiness and engagement may apply. The first is taking the communication to community settings, and this is holding the option of holding a variety of different community-based meetings, particularly in those areas where it's possible that there will be an elevated risk for a variety of reasons, and engaging some of the community members in the discussions. It's certainly important for us to be sharing information, accurate information, timely information with members of those communities in a direct way like that. But it's also important to have the two-way communication, having those meetings early, before there's a crisis, when it's sharing what we know about Zika and the risks, but when we're also asking members of the communities to help us to identify what some of the policies may be that will be useful in terms of preventing risk, can be very beneficial. And I reflect back on a time when we were responding to some of the risks post 9/11. We're holding meetings in housing developments around the city the residents of those housing developments actually came up with terrific suggestions for us about the way to engage the community more actively in thinking about emergency preparedness and taking action steps themselves. And so we may find that those members of the community are actually coming up with policies of their own. For example, tenants associations developing policies around being on the lookout for breeding grounds for mosquitoes within the general vicinity, sharing information in an accurate way through a housing unit. Maybe the kind of policy that we can encourage other people to take initiative on in order to spread the information. A second type of approach where communication links up to policy is through the convening of a wide variety of different sectors. This can be done, obviously, by a governor, by a mayor, by a health official, but bringing together those early on in the process who may be useful in terms of helping with the planning. So some examples of the kind of people that could be invited to a strategy session would be, that are particularly relevant to to Zika, that is, would be members of the WIC program in a community or at the state level. It could be school superintendents. It could be housing development overseers, as I'd mentioned earlier, as well as members of the business community. If we're sharing information that's accurate and update about Zika and the risk, we should be encouraging our partners to be thinking about the policies that they can adopt, which reflect our information with regard to the risk, but then are adapted to those local and specific communities and sectors. It's not too early to do that. In fact, the earlier that we engage those communities, the more likely that we're going to be ahead of the game. Now let's move on to the question of mosquito control operations themselves and focus on the policy issues. As I think everyone knows, the state, local, and tribal governments have the legal authority to put in place or strengthen mosquito control before a situation becomes an emergency. And mosquito control programs are already in place in most jurisdictions. However, the specifics of the authority may vary significantly in the different locations. Programs may or may not include all aspects of the bullets that are on this slide. So they may include surveillance and reporting. They often will include breeding ground reduction and pesticide application. They may or may not include the outreach and education. It's worth reviewing those and determining what aspects of the existing mosquito control activities need to be adapted in order to take into account the different circumstances surrounding Zika. Some states have already begun to take preliminary steps to do that and adapt their existing authority with Zika. So, for example, North Carolina has recently added Zika to its disease reporting list, and other jurisdictions are proposing new laws for consideration. An example of that is that Puerto Rico has proposed a waste tire storage and removal bill in their legislature as a result of the recognition you heard earlier of the likely elevated risk of the Aedes aegypti breeding in tires. So a Zika plan should involve familiarizing yourself with the full range of laws and regulations already being used as part of your mosquito control plan and noting past practices and potential gaps and considering how best to address any of those identified vulnerabilities. In addition to the substance of the laws and the regulations, it's important to review which entities within your larger jurisdiction have mosquito control authority. These may include specialized mosquito control districts, as well as local government, tribal, or federal authorities, in addition to that of the state. We saw, for example, the map that was shown earlier with regard to county mosquito control, but in fact, in each of those jurisdictions, there's probably overlapping authority with states, counties, sometimes tribal, sometimes federal lands. In some states, we know there are maybe mosquito control districts that include counties, cities, and towns, and which have the legal authority to enact a mosquito control program. Such districts are likely to be completely independent of local and state health departments, and therefore taking steps to make sure that the communication is strong between those types of mosquito control entities and health departments is important. In other states like Alabama, the counties and the cities are the lead mosquito control authorities. And still other states, such as Delaware, the state agency may have the authority to institute a mosquito control program for the entire state. So it's important to familiarize yourself with the specifics and as much as possible to ensure that the various authorities that are involved in different aspects of the response at different levels of government are sending the same message to the public. When we talk about the importance of building trust with the public, nothing could lead to greater distrust than if you have one county mosquito control program putting in place a very different policy with different messages than the one in the neighboring community. So an early assignment may be to pull together the different mosquito control entities within your state and try to have folks around the table sharing the information that we're talking about today and developing a plan to have a consistent approach that crosses those different jurisdictional lines. And to make things even more complicated, when you determine whether the state government, the local government, or both have the authority to establish mosquito control programs, it's also necessary to work with the different departments within those different levels of government. Just to give you an example of where you can have different governmental involvement in developing a coordinated mosquito control plan, I'll use the example of Georgia, but this is true of many other states as well. In Georgia, the health department has the primary authority to control the mosquito population in certain situations, like at large gatherings or in response to the management of solid waste. But the Department of the Environmental or Natural Resources has the primary responsibility over other areas, such as management of mosquitoes at scrap tire businesses. And then furthermore, in many jurisdictions, including our state, the Department of Agriculture has the authority to issue licenses for pesticide applicators. And so when you're developing your Zika plan and you need a coordinated approach, you need to have all of those different agencies at the table in a sharing responsibility. You heard earlier that one approach to ensuring that happens is to see if you can identify a Zika coordinator. A Zika coordinator could be at the state level or at the local level. It would need to have someone who had the authority to identify that person so that they could actually direct those different entities to work in a coordinated way. That could be done sometimes with the existing laws, and in other cases you may need an emergency declaration to have the authority to have a single person or agency designated as the lead agency in developing that kind of response. Similarly, you may have heard from the presentation earlier this notion of swarm leadership, where you can get a lot of different agencies that are working together, but they have a similar approach that allows them to work in sync with each other. That doesn't always happen just automatically. That requires sometimes joint training, joint exercising, and some agreement on principles for coordination. In virtually every state and community, there are what are known as nuisance laws or regulations, and such laws have broad authority for the government to take steps to protect the well-being of the public. But the content of those nuisance laws may vary quite dramatically from one jurisdiction to the other. Some have been used or adapted specifically to address issues of mosquito control. Others have not. One positive example is in New York City. They have long used the nuisance laws to ensure that property owners don't allow risky mosquito breeding conditions to occur. And the authority there has been tested already in combating West Nile virus. In other areas, those nuisance laws may not have been tested in the courts or through challenges, and it may be important for you to determine where you will use them, confer with your general counsels about what's the likelihood that they will stand up. Those involve such things as going into property that's privately owned if it's been neglected and taking action in order to reduce risk. So key lesson there is just to become familiar with the nuisance laws in your state. And if you need to consider the feasibility of changing those laws and regulations to confer with the experts in your jurisdiction. In the past, we've seen many different levels of government where declarations of emergencies have occurred for mosquito control threats. On the local level, West Nile declarations have been issued by mayors, city managers, boards of commissioners, and judges, just to name a few. And at the state level, governors and state health officials have declared emergencies for West Nile virus, for Zika already, or for other mosquito-borne illnesses. And at the federal level, this can be done too. Already, we have seen the governors of Puerto Rico and of Florida declaring public health emergencies to respond to the Zika virus. Declaring the right kind of emergency, if you decide to do that, is important. If you have there are different types of declarations that may occur. Some are disaster-related public health emergencies, even mosquito emergency-specific ones, and you have to make sure that you're drafting and proposing the specific one that will allow you to accomplish what you want to accomplish. At CDC, we have a public health law unit that is available to offer examples of the kind of language that had been used across the country, if that would be helpful to you. This just gives you some sense of what the kind of powers that can occur with the declaration of emergency can be. A declaration of emergency can, in fact, be simply symbolic, or initially it can be symbolic in terms of drawing attention, showing seriousness of the issue, elevating the awareness of the public that they need to take action. But it also can be helpful in terms of activating emergency response funds, as has been the case in Hawaii, of appointing a response leadership and requiring interagency coordination, as Florida did in February, of suspending laws that might inhibit the response, such as waiting periods for governmental procurement, as was done in New York, or increasing disease reporting requirements, as California did for West Nile virus. Now, because of the length of today's session, we focus only on one issue, those related to mosquito control and vector control. But I just want to mention a couple of other policy issues to put on your radar screen. One of those includes examining the issue of access to reproductive health and contraception, given the risk of microcephaly and other birth defects. You may want to consider how to assure families have ready access to needed services as they're considering when to have a child. In addition, you may want to think about some of the reimbursement issues early on, talking to a Medicaid director about if there are recommendations that change with regard to who should be screened and who should be tested. What are the issues that will arise with regard to reimbursement? Not too early to begin to have those discussions, because the response to those discussions often take some time to occur. So finally, just in terms of summary, in conclusions, I'd say there are a few things to take away from the presentation. First one being, take steps to achieve community buy-in and support the involvement, the active involvement of multiple sectors in developing policies that are that reflect the science related to Zika, but may in fact be policies within their sectors. Involve your stakeholders and communities as much as possible. They're your best allies. Secondly, consult with your attorneys and your experts to make sure that you understand your existing authority through the existing laws that it exists, through past practices, through the nuisance laws. Also assess your jurisdiction's risk and understand the day-to-day mosquito control system that currently exists and the role you play in it, your existing authority, and whether or not emergency powers might be needed. And finally, I would say know and work well with those with whom you share authority and the key governmental sectors both inside and outside of your level of government, and convey the policy approaches thoughtfully and fully to the public. Thanks very much.
Good afternoon. It's my pleasure to be here, and I'm here to offer a local perspective and hopefully some lessons that were learned from a dengue outbreak that we experienced in Monroe County, which is Key West and the Florida Keys. And I can assure you the perspective from ground zero is a great deal different from, well, any height you want to go from there. There's a wonderful New Yorker cartoon that says, that's a very powerful idea if it just made sense. And that's what happens a lot of times between the policy development and what happens with what happens on the ground. Everything that I have in my slides, except for the pictures, has already been said today. And you don't really need to go through those all over again. But since I made the slides and the pictures are nice, I'm going to make you go look at the pictures anyway. What I really want to do is leave time for questions and answers and try to make sure that our experience can help in this next experience that we have with the Zika virus. And if not with the Zika virus, there will be whatever's coming down the pike. I mean, when you leave here, Sarah assured me that you will get your CDC Junior Entomologist badge for you to learn more about the bugs than you've ever wanted to learn about. But you need to know about this bug because it is incredibly difficult to get. It's the one that lives in your house, and it's resisted efforts for a man to control it for years and years and years. So what are some of the things that we've seen? In the background is that we had, and I'm not sure why it's not, did I hit the wrong button? No, I'll do it this way. Excuse me. I apologize. The most photographed mosquito in the world. Hard to believe that this little thing could cause so much trouble. Anyway, we had an outbreak of dengue fever in Key West. It ran from August of 2009 until October of 2010. We had more than 90 cases that were confirmed. 2 of those required hospitalizations. Fortunately, everyone recovered. The first case was reported by a very sharp infectious disease doctor in upstate New York, whose client had absolutely no other way of having dengue other than from Key West. And so there it was. Just one day you are trying to do your job, and the next day you have what is a local outbreak of a disease in the Keys. How did the perfect storm create the perfect swarm? This dengue mosquito is the same as the Zika mosquito, and it happened, we don't really know how, except for the fact that you had all the elements present with the infected mosquito or the infected person, the right kind of mosquito, and the next thing you know, you have a local outbreak. And this is something that I will point out very, very quickly. One, the pictures are good. We have helicopters in the Keys just like they have in New York City too. But as I had said earlier, it is an irony that if you talk about what happened in Harris County or what is happening in Houston with a very active health department and a very active mosquito control program, and in Key West, we have a mosquito control district, and our director is here, that has a budget of over $10 million and a very, very active and a very, very innovative and effective mosquito control program. and yet you have the outbreak of locally acquired mosquito-borne mosquito-borne virus within your community. And I show here too that you have resources, but you'll never have enough resources. The first thing to start off and recognize for yourselves right now is that this mosquito, if you have an outbreak or this situation, will require much more resources than you have locally. And I would say that probably if it is a widespread outbreak, you are going to have you're not going to have enough resources actually to deal with it on a widespread basis. And the reason being is the infrastructure that needs to be built really isn't there in other places. And this conference, I think, is helping with it, but from the local aspect, even with great resources, you still can have the outbreak. You see here, and you've seen these before, you've got technology with the helicopter, but the most effective things that we were doing were the first 6 weeks of the campaign, Mosquito Control transferred 30 of their ground inspectors into Key West that did nothing except go from house to house and do two things. One, educate the public, but also do everything they could with regard to controlling the mosquitoes. And at the same time, when it came to us, we moved from preventing the bite into, after I got over denial, of course, got into what are we going to do and how are we going to do it. We do very well with emergency responses, but this was a situation that we had not been involved with. So the first thing we did was to reach out to the CDC and the Florida Department of Epidemiology and Disease Control. We got tremendous help from them. The picture with the lady in the helicopter is Dr. Kay Tomaszek, who was the acting dengue branch director at the time. She spent several days with us in Key West, helping us to design what our response was going to be, and her assistance was invaluable. Involving the whole community started then too, and that was a process that hopefully had begun before, and that people will understand now is the time to be doing that. But when we had the first case, we then did a sero study that involved going to every residence within a 3/4 mile of the first case. And in order to do that, we used health department staff, we used volunteers, we used the CDC and the health department employees that came from Tallahassee, and we used the Florida Keys Community College nursing program students. I bring this in to emphasize again that is a very resource consuming situation that you'll find yourself in. And if you do have an outbreak, we also went to each medical provider and made sure that they knew what the latest protocols for diagnosis, testing, and treatment was for dengue. I would say the same thing is emerging here with Zika, is that the medical community needs to know what we know as soon as they can, but the problem is there's so much we don't know, which needs to be admitted, which leads us to the next part of where you go, and that is, how do you make sure that your community is engaged and ready to help? We did everything that we could. I think the direct marketing efforts of putting hangers on people's doorknobs was the most effective that we could have. But we had town hall meetings, we had routine press conferences, we even had town meetings where we had mosquito control experts come in and answer questions. And we partnered very early on with Tourism Council for the Keys, who we let them know what we were doing and what the situation was, and they in turn helped us produce videos using our medical director, and also helped us with other media so that our visitors coming into the Keys could feel like they were being taken care of. And so what have we learned? This is the slide that I debated whether I would put in. It's a kiss-up slide, sort of, but I feel like that for a society that's quick to judge, we also should be quick to give praise. And from a local perspective, which is my personal perspective, obviously, but I think the commitment of resources of the time and effort like this conference that we are having, the CDC's actions through Dr. Frieden, and also the actions that our Governor, Rick Scott in Florida, took, demonstrate a really maturing and a really ability to see this as an emerging disease that needs to have resources put to it, but also needs to have leadership on it. And I think we're seeing this. I think that it will be that you will see, if a local outbreak of dengue occurs, that you'll have an easier time than we did. At least I hope so. Here is really the meat of a lot of our experience, is that resource issue that I said again. Your budget, human resources, it takes time, and the time is another resource. Addressing media and rumors is very difficult too, in the sense that if it's said on the internet now 3 times, then it's got to be the absolute truth. Y'all are aware of that. We face that, and it's a matter of just being consistent and being willing to meet with whomever and whatever. Health equity was something we addressed because the areas where this mosquito can be more prevalent are going to be in areas that may be economically disadvantaged. And I think Zika is going to require enlisting expertise of partners that we don't usually reach out to in emergency situations, such as our primary care providers, our federally qualified health centers, sexual health providers, and family planning with the emergence of the sexually transmitted part of this disease. They're not normal partners, but they can give us incredibly innovative ideas of what strategies work, because you're dealing with all levels of society, and you've also got to make sure that the cultural aspects are understood. In the Keys, we have a very, very diverse population, from Eastern Europe to a lot of Caribbean. And so all of those issues need to be addressed to get your message across. And the thing about what are we going to do with prenatal and postnatal care? A lot of these individuals that may be most at risk will not have access to that. And that'll be for the community to figure out how you come. And so therefore you'll have to be looking at social services, because what comes next? And then probably as important as anything, that's where we are, with apologies to Tip O'Neill. But it gets down to the fact that even on a national or state or local level, that while all politics is local, all public health is local. It doesn't really matter whether the ideas are great or the policies are fantastic, unless we're sure that it will be able to make people safer, healthier, or to prevent them from getting the disease in the first place. I thank you.
Well, thank you, Bob. Now we're going to open it up, and we'd like to open it up not just for questions. We'd actually like to open it up for more of a discussion. This is a smaller group than we started with this morning, because this is a breakout group. So please do ask questions, but we'd also appreciate hearing from you about what your experience has been, what you think some of the lessons are that you've learned, or if you've experienced some things that have raised your anxiety level and want to share those as well. But please come to the mics and let us know what you think.
Hi, I'm Ken Fujioka from Los Angeles.
Hi.
Robert, in your experience during the dengue outbreak, how well did the public buy into what you were trying to do? Did they did they have an expectation that you would provide continuous mosquito control, or were they helping you out by doing control?
I think the answer for that is yes, both to your questions. We have very active mosquito control. I mean, like I say, there's a budget of $10 million. But the issue became, as we went on, that regardless of having this kind of commitment of government services, you had to admit that the government could only do so much, and that you needed to enlist the community involved with doing their own part of eliminating the breeding sites. And the mosquito can breed in just so many places that you really have to have the community to say, I'm going to look at what's around my house and get rid of as much standing water as you can. In the Keys, it's a small area or whatever, but bromeliads, air plants, are very, very popular. Each one of those will hold water. Each one of those that's holding water is a prime breeding site. So when we had very consistently and very continually used our efforts and went forward, I think the community became more and more aware of what we were trying to do, and the direct marketing paid off, and they were buying in more, that they had some responsibility to do it also. I mean, you know, you got to go get this mosquito. As it was said, you can't spray our way out of this, and a lot of the efforts that you think of nuisance mosquitoes won't work, because it's wherever there's standing water you can have mosquitoes breed. And the thing that probably was most successful is driving that population down. And also the public in Key West started to get the message that they needed to close doors and put screens on. And I think this is another area that we got response from, in another situation that was to be aware of what you needed to do to prevent being bitten, and the community bought into that.
Hey, Brenda Fitzgerald from Georgia. Unlike Key West, Georgia does not have a whole lot of well-established mosquito control programs, and neither do we have $10 million for each one of our 159 counties. So my question is, in reality, when we leave here, because I've heard you say over and over that you thought that individual control around the house is the most important part. It sounds to me like maybe we ought to spend more of our monies convincing people to do that individually around their house than necessarily ramping up. I mean, certainly when there's an identified case, we have to go there and do that. But can you comment on that? Because obviously, none of us here will have enough resources, as you have mentioned. So can you very practically say what you would do?
Is that addressed to me?
That's both of you.
Oh, okay. All right, John, answer that.
You know, I certainly think it's true that enlisting the public in ways that they can practically be involved and to give people concrete guidance on the steps they can take around their house is great advice and makes perfect sense. I think we need to be guided by the science and look at where we see mosquito activity and where we think that the risk may be greatest based upon what we know about the mosquito activity, and concentrate more resources there. So I think it does vary depending on where we are in the response cycle, but I think giving people concrete and specific tasks that they can take on both at the individual level and for community organizations, including businesses and schools, does make sense.
I would agree, and I also think that right now we are dealing with Zika at this conference, but 5 years ago I was dealing with dengue. Nothing really changed, but it's interesting that it's the same type of virus. It is exactly the same mosquito, and nothing really changed. So the answer to your question is we've got to start marshaling those resources, reaching out to people that have been able to have mosquito control resources, but I think it's incumbent upon local health, but also I think it's incumbent upon the public health community in general to start explaining to the public that this is not a disease du jour, that this is an example of what all the budget cuts that continue to happen are bringing. You know, the only reason I mean, if you look at, the only reason you had Ebola in Africa is because they didn't have the public health system we have here. And if you keep dismantling the public system you have here, then Zika, Dengue, Ebola, whatever you want is going to be a problem. And we're probably at that watershed point that, so it's like, to build those resources, we've got to convince people why they need public health. And it's across an entire community because it's a community issue, and if you don't get the community involved in it, then it makes no difference. I will say that, and well, if you didn't have air conditioning, you didn't have mosquito control, you wouldn't have the Keys, pretty much. I wouldn't be sitting here. But, I mean, the mosquito control in the Keys is a special taxing district, and that's what, it's 100% funded out of a 78,000 population county, 73,000, out of taxes. So if we can elevate it, public health, not just Zika, I would say, is elevate public health, then the resources should be coming. But it takes educating public leaders. It takes our being a consistent message and our being very, very credible as to why this is needed.
Thank you.
Commissioner Fitzgerald, while you're at the microphone, I know that you're doing an innovative approach at the airports
Right.
for travelers coming back from
Right.
from countries where there is local transmission. Maybe you could just take a minute and share that, because I think that's an example others would benefit from.
Thank you. I'd be glad to do that. I mean, for us, we were obviously most concerned about travel to the islands, to Central and South America, because quite frankly, it's right in the middle of spring break right now, and a lot of us go to the Virgin Islands. I mean, a lot of us go to the islands. That's so the most important thing for us is to have an airport campaign. And we got great buy-in from our community. So we have a clip for the rotating loop on the televisions as you're watching when before you fly out. I'm on there talking about, if you're going to one of these countries, I want you to wear mosquito repellent the whole time you're there, and by the way, 3 weeks after you get back. And we have big signs. That the airport was a great partner. We have signs on the way out that show if you're going here, you know, wear mosquito repellent there, and 3 weeks after you come back, because in Georgia we don't have endogenous cases, but we have both kinds of mosquitoes, and we have a lot of people that are going to Georgia. And what I'm saying to our local newspapers is, you know, the real threat to you is your friend has gone to the Virgin Islands last week, because all of us know those folks. A lot of Georgians fly to the Virgin Islands, and they come back, you're in your backyard having a barbecue, and that mosquito that is a multi-biter bites you and then bites them and then bites you and bites this pregnant woman next. That's the real concern for Georgia. So we really concentrated our resources on our airport campaign first. And we also arranged with the local vendors at the airport. We gave them the list of products that are appropriate, 20 to 30% DEET, so they're carrying the right products. We have signs, and they just ask us for 30 more signs, 30 more, you know, newsstands and stuff want to sell insect repellent on the way out and on the way in. So, and that was very inexpensive.
That's great. Thank you for that.
you.
Thanks for sharing that.
If just to follow up and with Commissioner, is the thing that concerns me is if you think about what happened with us in Key West, somehow it got into the community and
Right.
it bubbled along. The thing is, we are really focused on Zika, and this gets back to exactly what you're saying with resources. How are we going to sustain, because the issue is not going to be the travel related. We know we can react. We know who they are, and they come back. It is the ones you don't know.
Exactly.
And all of a sudden, we're talking about 6 months, 9 months, a year down the road, and the first time you're going to know that you actually have issues in your community is when you start having microcephaly, and then what do we do?
Exactly. It's very concerning.
Thank you. I think we have time for one more question. Dr. Hasbrook.
Great, thanks. Lamar Hasbrook, Executive Director for NACCHO. Thank you both. So we know very well that public health is profoundly local and politics are local and therefore policy is. So my question is, or my consideration is, given that every health department or every municipality is going to be at different places, I wonder to what degree CDC has thought about at least a standardized approach for these municipalities doing this evaluation. So an algorithm that allows them to look at, assets, funding, authority, and other things like that, so that they can figure out what their gaps are and then take some common sense approaches to addressing some of those gaps, in particular in policy. So I'm wondering to what degree you guys have thought through that, and where there is a gap, perhaps a menu of items of things that they can do in first steps. Because many of our members kind of struggle with how to turn, need into actual concrete policies that's going to really address the issues.
Yeah. Thanks for raising it. I think that I think what we have seen is that there's no one-size-fits-all approach. Right. That there are certain local health departments that are large and have robust mosquito control programs that are, quite sophisticated and significant. And then there are also smaller communities that are rural with very small health departments and limited resources. And then it's also complicated by the fact that, as I mentioned earlier, the way that mosquito control operations are organized, they're sometimes clustered together multiple counties, cities in a different area, and then the authority for doing the mosquito control activities are vested in that district rather than in a local community. So I think there are some key things that are important for every local community to be looking at and asking, and I think that involves determining who does have the mosquito control authority, whether it's vested within their jurisdiction or in a larger jurisdiction. Are they at the table? How do they get to the table? How do they get involved in looking at the various issues that exist that we enumerated, and making sure that the specific needs of a particular community get put on the table for the mosquito control activities, whether they're being organized at the state level, the district level, or county level. So important to do that, and I think we've got some materials that I think will be useful for local communities that are attempting to do so.
Great, thanks.
I think you'll see that probably coming together with the policy, because as I say, from what you look at from right now with the CDC, I would suggest for NACCHO and things to do is, the first thing is to take an inventory to really decide in a situation in any county, any health department, who's going to do what, when, but you've also got to know what needs to be done. So I think that information is getting out there. I think if you put that together in a way that is almost a checklist, who does what'll need to be done, and then you'll have to follow the assets or the resources are going to have to come later. But if you start seeing a number of births with challenged, compromised births, you will find that there'll be some resources coming your way. But you got to know what you need first.
Well, thank you all for participating in this section of the summit, and now we'll turn things over again to Sarah Ziegler.
Thanks to John and Bob. A very great session. Thank you. And for those of you who have been in our virtual audience today, that actually concludes the webcast portion of the Zika Action Plan Summit. If you're looking for more information, all of the slides and materials that have been part of the Zika Action Plan Summit will be on our website at cdc.gov/ZAP. They will be posted. Any handout, any slide, and the entire webcast will be archived and will be available to anybody who attended in person and also participated virtually. In addition to that, if you have questions about your Zika action planning, you can also contact CDC through the email address preparedness@cdc.gov, and that will be handled by our Zika response team, and people will be able to follow up with you. Again, if you have questions about Zika action planning, you can contact preparedness@cdc.gov.